What's up, Fit Fam? Welcome back to the channel. So I've been waiting to make this video because I wanted to wait until it got a little bit closer till time for surgery. So yes, in fact, you did hear that right. I am going in for my 5th and hopefully final knee surgery. So I did get a different surgeon. I actually went back through some of my old videos, and there was kind of like this consensus through all of them that I was always having roughly the same amount of pain in the same location, and nobody was listening to me. You know, the first part of my surgeries really went well, or the recoveries went really well. And then as things went on, you know, like week 6, 7, 8, and so on, the same pain was happening in the same location. Nobody would listen to me. So I actually re-injured doing absolutely nothing my knee. So this was probably 5 or so months ago, maybe 4 months ago. I started having the same pain that I had last year before my 4th surgery. And I did talk to the surgeon about it last year when this happened. Long story short, I wanted him, while he was in there fixing my ACL, to look around and see if there's anything else wrong. He claims that nothing else was wrong and that it was pretty much all in my head and that this is normal. Well, I've had enough surgeries. I kind of have an idea what's normal and what's not at this point, apart from what is normal for me versus what is normal for, you know, your basic ACL surgery, because I have had so many. So could it be just pain left over from having so many surgeries, or because something's wrong? So before I go into too much detail, I did find a video that will help explain this a little bit better. And in my experience, nobody watches what I'm posting or listens to what I'm posting. They all make their own assumptions. So I ask you to actually watch the clip that I'm going to share, so that way you understand what's going on and know that fitness did not cause this. Now, we have no idea if my first ACL surgery is what gave me this issue, or if I was born with this issue. There's no proof, because I've never had an x-ray with my leg in this position before, so there was really no way to tell if this was something that happened 5 years ago, or if it's something I was born with, or something that just progressed over time. There's no real way to know for sure, so we can only assume. And considering I basically tear my knee so frequently, that we can assume that it has been going on for pretty much the entire length of, you know, since when this started 5.5 or 6 years ago. So the surgeries that I am going to have is they're going to fix my meniscus, because it is in fact torn. They're going to fix my ACL, because it is in fact completely torn. There's nothing left of it. It is completely shredded. And this is the ACL I got last year from using my patellar tendon. This time they're going to use my quad though. So I will have new scars and new incisions. So they're going to use my quad to fix my ACL. And then I'm going to have an osteotomy. So an osteotomy is basically bone surgery. So the reason for this is because my tibia is not sitting where it should be. They're going to fix the slope of my tibia, and ultimately the goal is that this will fix everything. So when I post this clip for you guys to watch, it will make a lot more sense, but I will use my hands the best I can. So here is, let's say, your tibia, and here is my knee joint. Generally, a healthy person's knee joint will kind of cradle into your tibia, so it's supposed to kind of sit down and up, almost kind of like an interlocking system, so your knee can bend, obviously. Mine is up and out, so instead of being down like this, mine is like this, and that is putting too much tension on my tendons in my knee all the time. So that is why my knee is tearing so frequently, because there is too much tension from my tibia. It's just constantly pulling. So even when I'm not doing anything, it just tears. Probably about 4 or 5 months ago, I was kneeling on the floor, and when I went to stand up, my knee kind of like jerked out of place. I was wearing my knee sleeves, so it didn't completely shift, but enough that it was a very sharp pain. And then I really couldn't walk for a little while. And that is when I tore my ACL again. So that was, what, my 4th ACL? I'm kind of losing track of how many times I've torn my ACL. At this point, does it really matter? I don't really know. But so I'm gonna go ahead and post the clip for you guys to watch. Please listen to it because it will explain in doctor terminology, I guess, the best way to understand what is going on. Now, this is the only video I could find on YouTube. It is not a surgery that happens very often. At least the surgeon that I'm seeing has explained to me that he has seen this before, but it's not something that he sees frequently. But it is fixable. So I'm going to post this. I do not own the rights to it, obviously, because this is a doctor posting his own content. So I'm just going to do a little short clip. Please watch it. It will explain a lot, because the comments from people saying that I need to stop working out because it is the root of all of my knee problems, this will explain that working out has been no root of any of my problems. I just have bad luck, I guess. I don't know. My tibia just doesn't sit right into my leg. So go ahead, watch it, and tell me what you think, if it makes sense. I don't really know. I'm feeling optimistic, but here we go.
Today we're going to do a slope altering osteotomy on the tibia for a 23-year-old boy that had ACL done approximately 2 years ago, and 3 months later he didn't have any major trauma, but felt that his knee was unstable. He had MRI done at that stage, and the surgeon at the time was due to reconstruct the ACL again, but it never happened due to whatever. So he came and saw me about 4 months ago, and we assessed him for why his ACL failed. And if you look over here, if you come closer, that we looked at the posterior slope for this patient. And the normal slope, if you look at anatomical studies, up to 7, maybe 10 and further. If you have a high tibial slope, what happens is that the tibia tends to sublux forward because of the slope. The femur rolls back on the tibia. So your ACL is always under tension, and there is a higher failure rate. So if you had a reconstruction done, and at about 6 to 10 week mark, the ACL graft is its weakest. But you've always got tension on the graft. So at this point, the graft is always under tension. And if you have a small twisting force, it can rupture even without having a major injury. So doing a reconstruction on this boy who's got a slope of about 11 degrees, if you look over here, it's 79.75. So it's about 11, 12 degree slope. Now, if you do the same surgery again with the same biomechanics of the knee, it's potential to fail. So we are going to do a slope-altering osteotomy, and then at a later stage do ACL. So how we're going to do it is we are going to do a tibial tubercle osteotomy, flip the tibial tubercle up, and then we are going to do a closing wedge osteotomy from the front, and we'll fix it. So we're going to show you how we're going to do that, and it'll be done navigated, so we can look at the hyperextension angle of the knee compared to the pre-op hyperextension angle.
Now, I hope that that explained a little bit about what's going on with my knee as to why this is happening. Going forward, I'm probably not going to post a lot of videos because I am working a ton of hours. My last pay period, we have 2-week pay periods. I worked 164 hours. I'm very tired. It is almost 6 a.m. right now. I called off sick from work last night so that I could get some rest because I've been working so many doubles and my knee is just killing me. My videos will be few and far between, per usual. Nothing changes up until surgery, and then I'll keep you guys very, very updated how recovery is going. Surgery is October 30th. And that's pretty much all I have, I guess, for the time being. Again, if you guys have any questions, go ahead and just use the description box down below. I really, really hope that this is the 5th and final surgery because I don't want to do this anymore. Just amputate it, you know, right at the knee. At this point, I will gladly take a fake leg over the amount of pain that I'm in constantly. I don't know. I have no words other than this sucks. It really, really sucks. But it is very humbling. You know, my first knee surgery, I was so quick to get back. I wanted to jump right back into things that I, you know, probably rushed it. I don't think it would have changed the outcome at all, but I was just so like ready to go. Second surgery, I was really sad. It was kind of like a grieving process. I was really upset. I just felt like I couldn't win. By the time the third surgery came around, I was just like, come on, guys, like this is just ridiculous. Fourth surgery was just a add-on to my third surgery, so it really didn't do much other than set me back a whole nother year. This surgery, I'm hoping that this surgeon can help me long term. Like I said, I did find a new surgeon, or at least I thought that I said that. If I didn't, I found a new surgeon. I'm going to the University of Pittsburgh. It was kind of a weird roundabout way to get to him. My physical therapist referred me to a MD, which is not a surgeon. It's just a regular doctor who can, you know, diagnose, prescribe, whatever. He got me an MRI. He tells me that my meniscus is torn, my ACL is fine, blah, blah, blah. He gives me a couple options that I could have surgery or I could do the PRP treatment, which is that platelet-rich plasma. Say that 5 times fast. I wanted surgery because I don't want to waste money on something that may or may not work. Obviously, surgery has the same outcome, may or may not work, but at least when they are inside my knee, they can see fully what's going on, versus that PRP is not covered by insurance. It's like $900 for one treatment, and it doesn't last long term. You know, obviously, if it heals something, then that is long term, but it's not something that generally lasts forever. You know, so I wanted something that's going to give me the best chance of lasting forever. So the MD doctor who diagnosed my meniscus as being torn referred me to a couple different surgeons. I chose the one that I guess had the best reviews. I did a lot of searching online and it was just a mess. So I did go with the one that had the best reviews. University of Pittsburgh, obviously the sports medicine side, they do see a lot of athletes, and this doctor was very understanding. It was very quick in and out. Like I didn't really get a whole lot of time to just sit down and discuss with him, because as soon as I got there, he's like, how do you feel about another x-ray? And I'm like, sure. You know, I just drove 2.5 hours. I might as well. So as soon as the x-ray was done, he was like, I can tell you exactly what's going on. I was like, okay, so quick enough. Let's go ahead and get this done. Within like 10 minutes, they're already scheduling me for surgery. And I was like, I don't have enough time saved up at work. Do you think that we could discuss this a little bit more? And they're like, yeah, just give us a call, but we're going to tentatively schedule for your surgery date. And I'm like, okay. So here we are. Surgery is October 30th, like I said. And I guess just look forward to some gruesome videos and very painful recovery. I am not going to get a nerve block for surgery until after surgery is over, because they told me that the amount of pain I'm going to be in, they want the nerve block to last longer. I'll probably spend the night in the hospital, which I've never done before. I'm usually in and out super quick within a couple hours of waking up. So this is gonna be my first time staying overnight in the hospital with a knee surgery. At least 8 weeks on crutches, which is very different than before. Usually I'm back to work after 6 or 8 weeks, depending. And yeah, I'm gonna be still on crutches for up to 8 weeks. I won't be going back to work until around the 12-week mark. The surgeon did want me to take up to 6 months off, but who has that kind of time? I don't. You know, and until I get famous, obviously I have to go to my job. So, you know, or you guys could just make me famous and then I don't have to go back. Anyways, I'll keep you guys updated. Until next time, guys. I'll see you later.